in the last couple of years, some really, really exciting therapies have been introduced.
Chronologically, the first big shakeup for small cell lung cancer in the extensive stage setting was the addition of immunotherapy, immune checkpoint inhibitors. And we had two successful trials back to back, the Empower 133 and Caspian trials, as they're known. And both of these showed similar outcomes, that if you add immunotherapy to the standard chemotherapy regimen that we've been using for decades in small cell lung cancer, that patients live longer, statistically significantly longer. Just to inject a little bit of sobering reality into the discussion, though, the benefit was modest, right? The number of patients or the fraction of patients that benefit from immunotherapy in small cell seems to be narrower than in non-small cell lung cancer. So there was still a lot of room for improvement. Probably 10 to 15% of the patients that really experienced long, durable benefit from the addition of immunotherapy. The others were responding to the chemotherapy and then fairly rapidly failing once they got beyond the chemotherapy. And so after the initial wave of immunotherapies came to pass, we've seen a few drugs that were approved in the relapse setting. So for patients who failed that initial line of therapy, be it chemotherapy or chemotherapy plus immunotherapy. The first of those was a drug called lurbinectedin, which functions in ways similar to a chemotherapy. It has a similar effect on cancer cells, but I think patients often find the story of its creation somewhat interesting because it's sort of a naturally occurring molecule. It's derived from a marine organism called the sea squirt. It sounds like something from science fiction, right? That you would find, in this rare marine organism, an anti-cancer drug, and it's quite effective even in patients that have relapsed small cell lung cancer. And then more recently, the approval of a drug called tarlatamab. This is the first drug to get approved from the class of therapies I mentioned earlier called T-cell engagers, which are really, really fascinating. I think that has been a much more recent game changer. That's, we're less than a year from that approval now. And I think people are still trying to figure out where it fits into the treatment paradigm and dealing with some of the unique features of this tumor, both in terms of its effectiveness, which is distinct from anything we've had before, but also its toxicity profile, which is also quite distinct.
So I'll be brave if you're brave. I'll be brave, but only